Other industries have really taught us all that their experiences can be individualized, it can be appealed to on an individual basis, and it can be automated through mass customization. So that means all kinds of stuff. Remember that I talked about the information popping up through the floor, through the ceiling, and through your walls? And there's all kinds of other stuff that's coming basically to answer whatever unmet need people have with the existing systems. I've listed a few here: the Minute Clinics, other professionals, telemedicine, remote monitoring, personal health records, community care, and the increasing irrelevance of geography.
Knowing your own data is going to be key. So payers are increasingly shifting to the highest performing practices. You've seen some of the movement toward narrow networks. Payment methodologies, we heard from Dr. Kalin, are starting to shift to outcome, to some of these other kinds of payment mechanisms. And providers are going to increasingly be incented to send referrals to the highest performing practices. So all of this is taking place, high degree of transparency, and it's only going to increase. The consumers, your patients, are going to know this. The businesses are going to have this kind of information. You need to have this information and understand, how am I performing relative to my peers? One of the messages we like to bring is it's going to happen regardless. All of you are familiar with the health grades, with the vitals. You're going to hear about Castlight. You're going to hear about iTriage. They're all moving down, getting data from various sources, and they're presenting it out there for people to see, for your patients, for the other providers who are deciding whether they're going to refer to you or refer to somebody else. So part of the message is it's got to be about engagement, and that better that you're working with organizations like ours and others to have a chance to say, how are we shaping this stuff, because it is going to happen.